Welcome to Behind the Mirror podcast. Thank you for watching, listening, liking and subscribing. I'm Lisa.
Hi, I'm Laura.
And today's guest, we have the wonderful Lyndsey, who is a former doctor and is here to discuss all things healthcare, hair, some skin, some nails, and just generally have a wee bit of a gab with us, which we're so excited for.
Great, thanks for having me.
Not a problem. So I think the main thing, we may as well kick it off because it's affecting so many people, is the elephant in the room, no pun intended, is the weight loss jabs.
Yeah.
Like Mounjaro, Ozempic, all these things. Because, so I don't know about you, but I've got a lot of people coming in and their hair has gone from good or medium to not so great.
I feel like everyone's jumped on this bandwagon, but then actually it's only now that you're starting to see the effects, which, don't get me wrong, I think people would still rather lose the weight and their hair be affected, but I think there's ways that you can sort of limit the effect on your hair as well. I just think there's not enough knowledge about it just now.
Yeah. So if you get, like, so from a medical perspective, why is people's hair falling out? Why is it becoming brittle, fine, not so great? Obviously, people are losing obscene amounts of weight really quickly.
Yeah, great question. So when I was looking into the research in this, so what you have to remember about research is that people are experiencing these things in real time and then reporting things, and then studies are getting done and then produced. So even the most up-to-date research isn't the most up-to-date, if that makes sense. But so the main school of thinking is that it's down to the rapid weight loss. So the fact that it's happening so quickly and the metabolic stress on your body. So the fact that you're potentially, so with weight loss injections, they tend to make your body not, like, it's an appetite suppressant basically. So you won't necessarily feel hungry all the time, or like particularly if you're on higher doses as well, you have a increased appetite suppression. And so if you're not feeling hungry, you're potentially, the things that you're choosing to eat to stay in your calories over the course of the day are maybe not the most nutrient dense or like well balanced. Okay, so if you're still able to eat like a certain amount of calories every day, and be in a weight loss, a calorie deficit, and then that not be full of nutrients and stuff. So if bearing that in mind, and the fact that you're losing weight so quickly, that has an effect right across your body. And one of the things is hair loss.
Your body's not getting the vitamins it needs because you're not
so that's
putting them in, which it makes sense why it's affecting, I suppose, not just your hair at that point. It must affect a lot of things.
Yeah, and hair loss and alopecia wasn't one of the most like common side effects at the beginning. So, and often people weren't finding them to be immediate either. Mm-hmm. So they were feeling a lot of kind of gastro symptoms. So things like diarrhea, constipation, vomiting, nausea, things like that. They were getting reported really quickly and they were really obvious. And then some of the hair loss stuff was becoming more apparent like months down the line. Mm-hmm. So yeah, one of the most recent studies I was looking at was saying that they're now trying to encourage people to report it so that it's like being noted as an adverse effect. And it's now going on the product information about it being an adverse side effect, whereas it wasn't really known about when it first.
As you say, though, it's not an immediate effect, whereas people were like, as soon as they'd taken it, maybe felt unwell, felt sick, whereas like the hair thing maybe does take a few months before you see it actually happening, which makes sense.
And especially if you've got like other side effects like vomiting, etc., you're not really going to be thinking about your hair. You're going to be like, oh my God, I feel unwell. I mean, the last thing you're thinking about is, how's my hair? Yeah. Like, you know, if you're being sick. Mm-hmm. And I think that's really important that they're actually putting that on the thing, because I certainly have found as a hairdresser that I'll have a lot of clients that go like, check my hair's okay. I mean, do you think it's because we bleached it 5 years ago?
Yeah.
No, I don't. And I know that my clients are amazing. They're not blaming me, but I think there is a misconception over like, oh, I had it bleached 2 years ago and my hair's never been the same since. Well, okay, what have you done subsequently since that? And like, yeah, if you've lost, I mean, I know people that have lost like 6-7 stone and they look amazing, and well done them, because that's a massive journey. And I don't think this is the air quote here easy option. And a lot of people will say like, oh, it's such an easy, you know, they've done it the easy way. I don't think constipation, diarrhea and vomiting sounds like something that is easy.
I think even like I've spoken to people and it has like an effect on some people's like mental health as well, like anxiety and everything can be affected. I think especially if you've maybe suffered from that in the past. So I think there's mental side effects as well as obviously that the sickness part of it. So I think any kind of journey like that's always going to be tough anyway on you. But
I think then probably what I've always said to my clients who have experienced this, because they do start to really worry about their hair and their image, because you've just lost all this weight, you're now image loving it, like you know, you're getting the clothes you want to wear, you're doing whatever, and then all of a sudden it's like, oh my gosh, my hair is not voluminous, it's not the way it was. And I've always sort of said, you know, there's always going to be a solution for that. I'm not a doctor and I'm not giving medical advice to anybody, but I think if you've lost 6 or 8 stone or something significant, potentially maybe the side effects you were going to experience as someone who was overweight are maybe, and now you've chosen to do that, you're maybe actually going to have a better quality of life going forward. Again, I mean, obviously without knowing underlying health conditions and stuff, and we have to presume that everyone is doing so under the guidance of a pharmacist or a doctor that's prescribing this medication and not someone that's selling it on the back street. But definitely, like, if you were going to live with that 8 stone, surely the side effects of your life were going to be worse potentially without losing the weight.
I think the biggest thing though is for like, as being a hairdresser, I think it's good that people now are aware that that's what happens, because there was a period of time that people were coming to the salon and their hair was affected, and like you say, they'll then start going, why is my hair breaking? Why is my hair getting so thin? Like, you're the one that's always done my hair, like what's going on? And you do feel a bit like, you know, well, we've not done anything different. And so now I feel like I'm glad there's a wee bit more of an understanding that actually, you know, it's because of this. There's nothing that I'm doing.
And also some people don't want to tell you that they're on it. So I've done a couple of people's hairs before, and I'm washing it and I'm like, oh my days, this is quite a lot of cast happening, like a lot more than, and we've maybe not done any colour product, I'm maybe just doing a cut and blow dry, and you're like, okay. And you don't want to turn around and actively say to someone, because there is a taboo about admitting you're on it. I don't know why, but there is.
And you also don't want to alarm somebody either. If they've not raised it to you, then you don't want to be like, whoa, your hair's really coming away here.
My sink.
I know. But
is there any, so medically speaking, is it does it stop when you stop the jag? Does it reverse? Like, what do you know anything about the aftermath research-wise?
Yeah, so again, because people are still on it, there's not a lot about research after the fact. But what is out there is that it's probably mostly reversible. So, and that might be important to speak to whoever your provider is about a specific side effect if you've got it, because it could be that you can manage it to some extent with kind of changes in your diet or changes to your dosage. But that's obviously going to be individual to each person in their specific situation. But interestingly, there was one study, so out of all the ones that were looking at alopecia, there was one study that said that over 90% of the patients who had reported hair loss had previously had hair loss.
Oh, okay.
So, like, again, that's just like one study, so that's not a ton of research. But I kind of like, personally, if that was me, I would be thinking, if I'd had any sort of history of alopecia in the past or any sort of like noticing of shedding or thinning, it might be something I was bringing up as a, do you think that it's going to be, I'm going to have that side effect, or can we watch out for this? Like, can we manage it somehow? So.
And again, I just think sometimes that doctors, pharmacists and things, like, hair for a lot of the professional industry outside of ours isn't important. It's like, are you vomiting? Do you have diarrhea? Have you got high blood pressure? You know, the main parts of the body. The hair, it's a bit like, oh, well, you lost a bit of hair. Do you know, like, whereas actually when it's happening, especially to females, it's such a huge part of your identity.
Yeah, and that was part of the thing that I noticed as well, was some of the mental health implications. Some of that was related around hair loss as well. So it wasn't just that it had some of its own mood-altering effects, but also if you then have hair loss on top of that and kind of a negative self-image, that can impact your mood as well.
Yeah, no, of course, because again, like you've just lost all this weight. You want to go off and show yourself out and feel really good. And if you're then looking at yourself that had big, thick, voluminous hair and then all of a sudden it's not so much, it would feel a bit kind of like, one problem solved and now I've got a new problem. You know, the good thing is obviously in our industry there are lots of safe techniques of extensions. You can put, as long as the hair quality is okay and it's assessed properly, you can add volume rows, like not heavy things, not weaves, nothing like that, but certainly like, you know, depending on the hair type.
There's methods that you can sort of use to sort of combat that temporarily, I suppose.
And I've been saying that to a lot of clients, like don't panic too much. There's usually a solution. I mean, there's like the if it got really bad, there's the sculpt hair replacements and stuff like that you can actually get. So it's just weighing out for the individual person the pros and cons for them. Yeah. Like, do I really want to lose this weight this quickly? Do I need to? Am I losing a stone and could I do that myself? Or am I needing this help to lose a significant bit of weight and change my diet and my portion control and my mindset around food, and this is the only way I'm going to be able to do this.
I think what's unclear as well from the research is that if you happen to just lose weight naturally really rapidly, would you have a similar effect of hair loss? Because if it's about just how quickly it's all happening, if you decided to go on a very extreme calorie deficit and you were also like massively up in your exercise and things like that as well, and you lost weight quite quickly, quite significantly, could you also have hair loss implications?
I often wondered about that, see, with people having like like gastric bands and things. I often wondered if it would be the same, because usually that weight loss is quite quick, isn't it?
So I've had 3 clients one had it in the UK, 2 had it abroad, gastric sleeves, and all 3 of them had significant hair loss.
Yeah, so it must come down to the same thing, the stress on your body then.
Well, it's and like the last thing, your body's going to want to feed its organs. It's not really bothered about its hair, nails and skin at that stage. It's probably going, oh my God, she's eating 1 tangerine today, like grab it, give it to the vitals.
So there's quite a lot about, you know, there's all these, now people have got these cures for the hair loss, like vitamin wise. They say that you should be taking pumpkin seed oil capsules and the usual like biotin, collagen. Do you think any of them have like an effect?
So that's difficult to say.
I know.
Because again, there's not really obvious research into that. Also, I think just generally with vitamin deficiencies, they often say, like, if you're taking supplements, that you kind of need to know that you are already deficient in that. Otherwise, you're just
overdosing.
Well, yeah, and not that that's necessarily like going to have a negative effect, but the fact that like,
they're really expensive.
If you're just taking it and then you don't need it, and you're getting it naturally. So my question to you guys was: I saw loads of stuff on TikTok about hair oiling. And people raving about that, all like continued like lengthening and strengthening, but also new hair growth. And have you seen any of that in your salons?
So one of the girls in the shop, she swears by the rosemary oil.
That's what I was going to say. The only knowledge I've got is that rosemary promotes hair growth. But the problem is that the follicle has to be there to grow. It's not going to, you can't rub that on a bald man's head and expect some form of miracle hair growth. It's just not. I've always been quite sceptical of supplements and No, I've always been sceptical about things that tell you that they can create you a big voluminous hair of head, because if you've never had that, where is it exactly finding it from? Do you know, I was born with 5 hairs and a sugary one, and so it wouldn't matter how much oil I slathered on my scalp, it's never going to be able to create me the illusion or the factual amount of more hair, because it isn't there in the first place. I was born with really fine, fluffy, rubbish hair. And so I think when people say, oh, you know, take this really expensive supplement, rub this really expensive oil, I genuinely think if there was such a product, and I'm not saying that this doesn't affect the quality of your hair, because absolutely vitamins and things will, you know, strengthen your hair, they'll stop the breakage, they'll maybe make it a bit fuller, but not to the point, if they could cure a bald man, there would be probably a lot less bald people. Do you know, if they had a cure that you could rub a lotion on your head and stimulate hair growth, that wouldn't be a thing. So for me, I'm always a wee bit like...
So that's where I think, like, so I know that massaging your scalp does definitely promote the blood to the surface of the follicle and feeds the follicle. So it's the best chance you're going to get of hair growth is by, I mean, they say that, like, your fingers are your, like, see massaging your head every time you shampoo it. That's one of the best ways to encourage your hair to grow. Aside from obviously if you've been taking, Mounjaro or whatever, just day to day for any average person. But so when you're using the rosemary oil, you're doing that, but would it work anyway if you weren't using that? Because you're still actively encouraging the blood to the follicle. So I don't know. I'm not sure. I think sometimes people just like, they see something and, they like a trend and it works and for them.
It smells nice.
Yeah.
A lot of people buy a product based on smell and not science. Like that, we genuinely know that to be the truth. Like you can have a shampoo, smells incredible, but is actually when we use it, we're like, oh, this was rubbish. It made the hair really dry, but they don't care because they're like, it smells incredible. And so it's difficult then. I also want to put out a disclaimer to anyone that's listening to this and thinks still, for whatever reason, that TikTok keeps doing this. Cooking coconut oil should go nowhere near your head, ever, under no circumstance, because it's not the same as what's in a spray. It's not broken down. And if you put that on your hair, it won't come off with a wash. You'll be left with little particles and it will fry in the heat.
I know.
So any heat you add to your hair, you're going to slowly cook your own hair. So, disclaimer, please don't use coconut cooking oil.
I know.
Because somebody said once, I had clients that were buying jars of it. And I was like, no, this is not a thing.
But products with coconut oil are okay.
Yeah, because they're like broken down differently. So the compound, obviously, the science of it is quite extreme. But yeah, it's like it's like cooking a different cake. You know what I mean? Like they've been made suitable for the hair so that they are much less clingy to the hair shaft, because coconut oil is so thick, and as soon as you've slathered that on, even with 2 scrubs of a shampoo, you're risking that it's not fully all off. It might visually look like it is, but the minute and second you're adding an iron to that or the sun, then you're risking serious damage. Oh, I'm talking about serious damage. Obviously, we caused carnage with the Go Blonder spray that Laura reviewed.
Oh my God, that's went nuts. It's so, I'm actually really pleased though how much it's been shared. It's on something like 400 people's stories, which is good because it still scares the life out of me. But it's funny because you get people saying, well, I've used it and my hair's fine. It's great. Love that.
I was trying to look for the profile photos of those who were saying they'd used it and that their blonde was just the same as a professional. Because I'm like, why have you not showed it then?
I know. But that's fine. The point of that story was that it affects when you come to the salon to get your hair done. So if you use it, fine, that's cool. But if you ever go to a salon, then you need to let people know. Because,
and if you like a 9G route, that's okay.
I know.
So similarly, would you appreciate if your clients were upfront about if they're taking any medications that might affect their hair? In advance. Yeah, we spoke about the consultations the last time, and I do think it's a massive part of the hair service is finding out not just what's on their hair, but some people maybe don't want to disclose medical, things, which can make it a wee bit tricky. But I suppose it's maybe just about asking a question that, is there anything that you're taking medically that could affect the service today? So you don't need to know about if they're taking tablets for I don't know,
blood pressure or whatever.
Yeah, or maybe so. But
it is awkward because we're not doctors, so then it feels uncomfortable to ask a client such personal questions. But I did a consultation the other day with a lady who's broken up with her previous stylist, and in the message said due to health concerns. So that prompted me to then say, you don't need to tell me what is wrong with you, but is it something that's going to affect your hair service? And did something happen in the salon? Did you take a reaction? Now, obviously, I run my own patch tests and things anyway, but, it's good to know if there's been some history. I had a client once who'd had anaphylaxis in our previous salon. She didn't react to Goldwell at all, so we were fine to proceed, but I've never been so nervous in my whole life.
I know.
We ran all the patch tests, we were all good, and then she was sitting there and I was like, are you okay? You itchy? You all right? You feeling ill? Are you okay? Are you hot? Are you...
it makes you nervous.
It does, because I don't even know what I would, you would just have to phone an ambulance, but that would be a very stressful set of highlights.
Yeah.
Oh my God.
Yeah, absolutely.
Yeah. So I think another cool thing to talk about, or something that you and I had spoken about previously, was just generally being a female, or born female, I think we should say, and having things like periods, perimenopause, because all of these things have effect on your hair also. And that's something that I get asked a lot. Women get to a sort of certain age where I cannot diagnose something, but they're not on a weight loss, they're not on anything, they've not changed anything about themselves, and their hair's maybe getting a bit finer, it's maybe, it's changing in texture, it's maybe not taking to colour just quite as well as it once did, it's not holding its shape. And so I think perimenopause has such a huge part to play in that.
Mm-hmm. Yeah, and I think as well, like often people who experience monthly cycles will have like changes in their cycles, which then it begins perimenopause, but they maybe feel miles away from menopause, and so that's not something they're even considering. And it can definitely have effects on your hair just because of the change in hormones. So like I think we were talking previously about kind of after having babies and after breastfeeding and things like that, just the hormone changes can affect like the type of hair that comes in. It comes in as a kind of finer baby hair kind of thing.
A new fringe that you're growing from the start of your head.
And kind of how as stylists you would treat those hairs differently. And but it's just, some people have really really successful outcomes with using kind of hormone replacements or sort of changes and adaptations to kind of strength training for their kind of perimenopausal symptoms, and that sort of helps with all over symptoms, and so can have an effect on your hair. But I think it's tricky because people who are kind of female at birth or presenting female will often feel like it's quite different to the male pattern baldness. So you tend to find that often a lot of women won't get kind of that same baldness that you would expect to see on males. But then obviously it's really significant to them. So
I think there's definitely like round the hairline, round the temples is a big place where I see a lot of clients who are definitely in menopause or just after, their hair has changed so much round these front sections. And people that have got really thick hair to begin with, I mean, even for them, it's still thin for them. Some of them have still got a great head of hair.
Yeah.
But
that's what you're used to.
It's what's your norm, and it always seems to be like round the temples. And again, a lot of people don't actually realise that. I suppose because we see it all the time, but I think there's, if they hear me say like, oh, that's really common, that's really normal, I've got a lot of clients around it in the same age bracket that they're experiencing, you can see the relief in their face because it's like, right, okay, well at least it's explained for. But it's interesting what you're saying about the perimenopause, because what's the kind of age, like what roughly does that usually start? I know it can vary, but...
Yeah, so when I was looking into it, it was saying that it can be in your 30s, and like the actual length of sort of from the beginning of perimenopause to menopause can be like something like 17 years.
Wow,
great.
Although the average is about 4 to 7.
That's amazing.
Yeah.
4 to 7 years?
I feel like everyone knows about menopause.
Hot flushes?
No, just the beginning symptoms.
Yeah, so you can experience hot flushes
for 4 to 7 years. Well, aren't you the bearer of good news this morning? Oh my gosh!
But and I'm not suggesting that it will be all extreme symptoms for a full 7 years.
Okay.
It's just that you might start to notice changes, and that whole process can
things that have always been normal for you then change slightly.
Would you still be getting a period if you? Can you get a period if you're perimenopausal?
Yes. So the definition of perimenopause is just a change in your cycle. And so once you've had your last period, that's menopause.
And that's
so
you're in the land of milk and honey by that point. Hopefully like the sweating and the memory loss and the hair loss and the skin and the nails and everything is just wonderful again like that.
I know, but then it's not really though, isn't your hair something like your skin and your hair stays the same after it. Doesn't go back to normal again. Sorry.
Welcome to our podcast. We are going to really make you feel good about it. Yeah. No, I think it's important to talk about though, because it is something that people then feel like they're going crazy, and actually it's like, so 30 is quite young, and then 4 to 7 years of an average thing. So you can still fall pregnant 30s, in perimenopause. You can still all these things.
If you're still having eggs released and having periods, you can still fall pregnant. And I'm not suggesting that on your 30th birthday you're going to stop having your periods. Just in your 30s.
So I'm like 39 this year, and that really makes me like think, because there has been changes to my cycle, and the cramps that I get now are awful in the last couple of years, it does make me think like, oh, wonder if that's something.
Because that could be childbirth, because that happened to me after Hallie. Like,
no, but he's nearly 3.
Oh,
I don't
know.
think so.
Is that?
But I don't know. But just what you're saying about changes, things that aren't normal for you, then, you know, yeah, I think there might be something in that.
I mean, I think it's just worth keeping an eye on, but also that it's...
I'm not hot. I'm actually not. I'm usually cold. I'm not hot. I look forward to the hot flushes.
Look at my wee bingo wing on that.
Just that if you've just... if you're having periods that are like further apart and you've just chalked it up to, all that, you know, that happens when you get a bit older, and I was just thinking you might not have clocked that some of your symptoms could be perimenopausal, because it's such a long period of it can be such a long period of time.
Oh, women are so lucky.
I know, aren't we just? I know.
So fortunate.
I think as well, because there's so many things about being a born female that do relate to the hair, like childbirth, like breastfeeding, menopause, your cycle, like all these things actually do have a massive effect on our hormones, and therefore do have effect on our hair, nails and skin. And that's something that is quite good to be aware of. Certainly I do a lot of extensions, and I will find people will tend to lose a few right around the time of their period. And so non-medical diagnosis have kind of said, well, you probably find that you're casting more hair during that time than what you maybe are at any other stage in the month, and therefore you've lost 2 or 3 over the course of that week because of that. And so as soon as they learn that, they're like, oh, right, okay, because I just couldn't work out why I would lose none, and then I would maybe lose like 2 in a day. And it usually aligns when I do a consultation when they return. It does usually quite fit the jigsaw, really.
It was just earlier when you were saying about how you might be okay with putting up with some like mild thinning or hair shedding if your overall health benefits are much more significant. And I think that that's often why people love the weight loss injections, is because it can be really helpful in something like where people are experiencing a lot of food noise, so they're not necessarily eating to feel full, but they're just eating because all they can think about is food, and it's meant to be really helpful in bringing down your food noise, and so then that helps people start from a sort of like this similar starting line to other people who don't suffer from that they can actually make healthier choices. They can choose what to eat in a day without having the background of food noise, and also it depends on how you're losing the weight. If you're having a more well-balanced diet, then you're less likely to lose muscle mass, and then that means it has a lesser effect on your metabolic. It has less of a metabolic effect, so that when you came off the weight loss injections, you're not necessarily going to just instantly put all that weight back on. Whereas they're saying that some people who have just lost muscle mass in that time and maybe not made the most what we would consider like well-balanced, nutritious decisions while they're on it, haven't really come up with a coping mechanism or a habit to be able to then sustain that once they come off the drugs. So it's kind of like your long-term impact as well. So if it's used really well, then it can be it could be a real tool to be able to help kind of break cycles and continue that great weight loss after so you don't need to be on it forever, which is what some people were worried
about. I suppose it's changing your lifestyle round it, isn't it? So that when you come off, you can still maintain a healthy.
So a really interesting thing about one of my gastric band, gastric or sleeve, I'm not sure what one it was that they had, but they actually had to go to psychology classes before and after to manage because you became, in theory, right? Again, not to upset anybody that might be listening that doesn't fall into this bracket. You've potentially became overweight because of bad habits that you've created throughout a lifetime. Bad choices, food noise, like you're saying. I'm not saying if there's an underlying the thyroid issue or whatever, that's maybe different, right? But if you've just done this through bad choices, then the idea with these weight loss fixes is that you need to fix internally as well. Your brain needs to be retrained. Because you've lived your whole life eating the wrong things, too many of the wrong things, not moving enough, not putting yourself in a calorie deficit. There is no point whatsoever in jabbing yourself, stopping all that if you're not going to do the work internally, because the minute you stop or the minute you've had your sleeve, you're just going to start your bad habits back up. And after you've had a sleeve, so basically obviously they're removing a bit of your stomach. Like they're tying it up, so you're really not hungry. So when you are hungry, they're very, very strict on like, you need to make sure that you're eating fruit and veg. So because all you're going to be able to eat is a tiny portion. So if you eat an apple pie, that's it. That's all your body's going to get for that meal. That your meal of that day is an apple pie. That's not nutritious. That's not going to be helpful. And so then you're just going to create more of a problem, and you're going to sort of undo the good work that has been done medically.
I know somebody that had one of them, I'm not sure what one it was, and she was really sick if she ate things that weren't healthy or weren't good for her body. It was like her body rejected it.
Yeah, so like we don't have space for good stuff, so get that back out of you. And every client I know that's had a surgical procedure done cannot drink alcohol anymore at all.
Oh, wow.
It makes them really unwell. Yeah. And also they're very, very, very drunk on tiny amounts of alcohol, because your stomach's full after one glass of Prosecco.
That was me on Saturday.
Look at her wee face.
I'm still
I know,
recovering.
I received the video evidence.
Yeah.
Are you going to show it?
No.
Cocktail pairing at 6 by Nico.
PG show.
Should come with a warning.
I think, so it's like, it's interesting to hear from people that have had these experiences, because so many things get bad names because people misuse them, and that's where it's like, I'm going on holiday, I'm just going to do a top-up jag. I mean, okay, or like, what did you learn from being on that? Like, so I've got a direct experience with a client, and it actually changed her life, because she now has portion control. Because while she was on it, she wasn't hungry, so she was making herself tubs in the fridge of little mini meals, and learned, well, I actually survived a long time on those size of meals, so that's what I should be eating. And when she compared, she did a lot of photos, befores and afters and things like that quite publicly. Her meal portions were huge before, and now I would still say it's a small plate for me. Like, I would say, like, maybe I think I'm considered kind of a normal eater, and I'm probably in the middle of what she was doing. Like I'd have a sandwich for my lunch, but then maybe a slightly bigger dinner with your veg and stuff. But yeah, like, it definitely changed her outlook. And now she's got a body she loves. She wears the clothes she likes. And when she feels like, these are getting a wee bit tight, she goes to the gym. She doesn't just reach for another jab because that's easy. Air quotes again. And I think that's where it becomes such a huge thing. We actually have done extensions on her hair, though, because it is...
I was going to say, how's her hair been?
Not good.
Yeah.
And that was her doing it really healthily. So I think maybe you're right. Maybe if I now am able to speak to her and say, like, previous to knowing me, did you have history of hair problems and things like that? But yeah, she's now got 50 extensions in, and her hair looks great, because you wouldn't know. You wouldn't know. Not because I just do it. Well, that sounded really arrogant after like a really serious conversation. Her hair looks fabulous now, because I've, but you know what I mean? Like, and I've sort of said to her, like, look how much your life's changed. You love yourself now, and you love your life, and you love your image. And so, yeah, okay, you have to fake it with your hair.
Yeah.
But
I think it's just known, isn't it? Like all the different symptoms that come with it. And then it's up to people what they do with that, isn't it? Really.
Talking of changing images, how do you feel as a former doctor about non-doctors, non-medical professionals administering things like fillers, Botox, and
yeah, that's a really interesting question. So, how do I feel about it? I think if I was going along to have a treatment, I would want to know what training they've done.
Yep.
So I think kind of historically, you would that you had lots of doctors and nurses administering injections kind of privately in clinics and stuff. And so then I think what happened was people expected that whenever you went and got these things at a clinic or wherever you can get them, that you were going to have someone with some sort of anatomical knowledge or some sort of how to deal with something if there's a medical emergency in that scenario. And so it may, I don't know too much about what requirements there are for people to be able to give these out. And so they may have done extensive training. But I would like to know that they had, just so that they, or find out what their health and safety protocols are, so that they say, in the event of this, we call 999, or we've got this emergency kit in the back that we administer this if you have an allergic reaction or something, I don't...
Yeah, because obviously sometimes it goes wrong and they need dissolved. I don't know much about, obviously I don't have it done and I don't have it in the salon, but my worry with hairdressers and beauticians taking on this role is, right, great, so the argument with beauticians is that they know the face better than a doctor because they only work on the skin, they do extensive training on the face and the thing. Right, okay, in theory, okay, give them their dues maybe, but then what are you doing if someone has an anaphylactic reaction? Because I'm wanting the doctor at that point, I'm not wanting the beautician. And I think the other worry is some of the bodies that are giving out these air quotes qualifications are not governed. They're not. So you see a certificate on the wall and it's like, was that a 1 day online course? Was it a week down in London in Harley Street? Where did you get that? Who gave you that? Was it that another hairdresser in the salon that you work just decided, come and watch me and I'll show you how to jab this in here and make this look better? And that's really scary because these are things that have in the past caused fatalities. They have caused damage to people, like we see them all the time, don't you? And like TikTok, social media, where people's lips have gone like massive and they no longer can eat and they're having to be rushed to A&E, and that puts pressure on the NHS as well then, because it's like, well, somebody's created a ripple effect of drama because they weren't properly trained and they didn't, I presume it should cost thousands to do these courses. It should, because you should have to have extreme insurances and things, because you're not just learning how to jab a face, you're learning how to sterilise your equipment, and that is a lot more serious than a comb. Mm-hmm. Like needle disposure and like, is that a word? Disposure? Did I just invent a word?
Disposal.
Yeah. Yes.
Do they have a sharp spin?
Who knows? Yeah. Well, but things like that, like who's thinking about these things? Like I heard a bit of a horror story about one of my clients down south, and she'd gone to get her hair done in her hairdressing salon. It expanded, and the next thing she turned down and there was someone administering, like a stylist was administering a jab to someone's face on the salon floor. Sorry, what? Like that is, it's not sanitary. There's hair flying around. There's particles of hair everywhere. Like it's constant. There's dust everywhere because it blows with the dryers. And what on earth? That is like just so unprofessional. And then there's so many levels to that worries me.
Yeah.
Like, and obviously we were talking, so we are involved with a company called We Love Purple Hearts, and their main aim is to get hairdressers regulated because we're not regulated. So anyone can call themselves a hairdresser. Anyone can add, we're working with peroxides that at one point were so strong they could build bombs. And they just, anybody could just do this on your head, and there's no guidance, there's no nothing. And I suppose the only bad thing that could ever happen is someone could take you to trading standards and say, this person's butchered my scalp and burned me or whatever. But they're working to regulate this, and obviously the same goes for these Botox procedures and fillers. They're trying to get much, much stricter regulation surrounding it. But the noise from the beauticians was quite heavy on like, we know better, we've done better, I'm better than nurses. I think it's such a tricky situation because it's not maybe about knowing the face better. There's got to be a medium ground but knowing the medical side.
I think if they know the risks and they're able to inform their clients of the risks, that would be my thing. It's like, are these clients who are getting it, at the reception desk instead of in a treatment room, are they fully aware of everything that they're signing off when they write their name against that waiver? Do they know
what do you think they're signing if they're getting it done at a reception desk? Because I'm thinking there probably is no signing happening. It's just like, all right, hen, here's your jab, and that's the worry.
And so I think if the people delivering the jags are fully informed of all the risks, they can inform their clients of the risks, and they can make an informed decision about whether that's something they want to go ahead with, knowing what worst case scenario is, but knowing that that's very unlikely. Then great. But how do we know that that's what's happening?
It's mental.
So there's something came into play from September last year. Now this isn't fact because I'm not 100% sure, but from what I've heard, something came into play from September. If you're administering Botox or fillers, you have to have somebody prescribe that
they have to be on
for
site,
you.
that is fact.
Yeah.
So there has to be a prescriber, a qualified prescriber within the clinic setting that you've
So I
got.
went to get Botox done this night, and this is the only reason I know about it, because the girl said to me when I went for the consultation, she said, so I'm going to actually need you to come back because I need to get somebody else to prescribe it before I can administer it. She said, we can do it over she tried to phone the girl, but she couldn't get a hold of her, whoever it was, a nurse or something that was going to prescribe it for her over the phone. And I thought, she doesn't even know who I am. Like, she's just prescribing this to this girl over the phone, assuming that the client's fit for it as well.
No, but she should be prescribing it to you. So what's meant to happen is it goes on your medical record. Like, I'm prescribing blah drug for blah client.
So the girl who was going to do the procedure was on the phone to her friend, or whoever it was, her nurse friend, to get her to prescribe, but she wasn't answering the phone. And she said, because as of September, I can't prescribe it myself, because she obviously didn't have the qualification. So she said, I'll need you to come back the next night, which I then cancelled the appointment because I was like, I'm not. Well, I thought if she's not even, she's not got, she can't prescribe it to me, which doesn't say very much about what qualification she's even got. And like what you're saying, if something goes wrong here, what, and our nurse friend doesn't answer the phone, like how's that going to leave me? So I cancelled it. And so I know that there's definitely a wee bit more legislation on, but I thought it doesn't really work if you're just doing it over the phone. Surely it should be in person, like that person needs to be there and do the consultation.
I think
it kind of defeats the purpose.
Also, the worry is, who's policing this?
Yeah, and I would worry, like, as a prescriber who feels comfortable just blindly prescribing, you'd want to have at least a consultation.
I know, and the whole thing just didn't sit right with me, and I thought, nah. Let's not
you
do this.
obviously have no background in administering Botox and fillers, but you are able to prescribe legally. You've done the qualification in which you're allowed to do that. So would you, as a former doctor, would you just be saying, I'm not? No.
I wouldn't prescribe now, but even
back when you were
when I
practicing.
was prescribing, I think I would probably. Yeah.
Well, that's on you. If something goes wrong.
There's so many different things at play when you're trying to like protect yourself, but also do the best for your patients. And so I think people don't generally like to blindly prescribe. And is what, like, it's definitely advised against as well. So, I mean, I think there would maybe be a few extreme circumstances where you would get everything you needed information-wise over the phone and you might feel comfortable, but on the whole, you'd want to have met the person, or at least have been able to take a full history from them before you want to prescribe something. But I never prescribed fillers, so I don't know, maybe the regulations on that are less, and you don't have to protect yourself as much as.
I think that's quite a worry, isn't it? That's putting doctors, nurses and prescribers in a predicament where they might be facing prescribing something they don't actually work with on a day-to-day basis. Like, you'll have had drugs that you know back to front, inside out, what they did for whatever, ailment it was that someone was experiencing, and you would know the side effects that were most commonly presented, through your antibiotics, like, etc. And then so to be faced with a situation where you don't personally work with that drug, you don't administer it, that's quite a lot of pressure to put someone under.
Yeah.
And why is the person that's prescribing it not being the person that's administering?
I
know, exactly. I know, the whole thing just didn't sit right. And I thought that's when you go with your gut, something that feels off. It's like, no way. So I'm not sure. That's the only experience I've got with it.
So I've never had anything done. So like, I have been looking into the idea. I would love to have something done with my eye bags. Like, they are, especially in this bloody light, and I don't know what light we've got going on today, right? But every time I watch these clips back.
If you were to go under any form of needle, you would die. You can't even go to the optician.
I've given birth now.
But you can't even go to an optician appointment and you want something done with your eyes.
I've got contacts now. I mean, it took me a few attempts and I fainted
Lisa,
a few times.
If somebody put a needle near your eye, you would pass out.
But can I not just lie there with my eyes shut? I wouldn't see it. I couldn't look.
I don't know.
I mean, you said there was cannulas in your eye and that did slightly scare me.
That was horrible. But we'll not talk about it. Have you guys seen the treat though?
You look amazing, and that's what makes me look particularly horrific sat right next to you as well.
I am all for, if something annoys you or something bothers you, do something about it though. Like, I'm a total advocate for that. Like, don't, but yeah. So
look at you sitting there absolutely flawless, and I'm sitting here looking like I've not slept in my whole life.
Hardly flawless.
So I would love to get something like that done, but I also don't want to risk my eyesight. I said to Laura, see, when you got that done, is there any risk of blindness? And she's like, oh, I don't know.
They're just like, what?
After the fact.
But they're not anywhere near your eyeball, so I don't know why it would
Put
affect.
a cannula in the skin underneath your eye, surely, if something slips or... Anyway, you're not blind and you look great, so it's worked out well.
But yeah, I'll give you a number if you're up for it.
100%.
Have you guys seen the salmon? Is it salmon sperm facials?
What?
I don't know anything about them. I haven't researched or anything.
My friend gets them done, and she looks amazing.
I've seen them right after the fact, and it looks like they've got like 100 spots.
Yeah,
wow.
From puncture
so it
sites.
rejuvenates your skin. This actual salmon sperm, and it rejuvenates your skin. And I have to say,
that
my friend,
is so weird.
My friend looks sensational, but she gets quite a few different procedures. So I don't know what one it is that's making her look as good as she does.
Funny. How does somebody discover that that's good for your face in the first place? How does somebody just go and find that one day and go,
no,
do you know what this looks like? It'd be really good for.
It's not like it's topical. It's like who discovered that if you inject this a specific area.
Oh yeah. Who's actually gone out and sourced salmon sperm to begin with?
Yeah, that's what I mean.
What a job that would be.
That's
like I've got a new career. Well, what is it you're doing? I'm a sperm catcher. What?
Bonnie Blue of the fisherman world.
She's pregnant.
I know I was going to say that to you. She's pregnant.
Apparently, it might just be. She's apparently a very good businesswoman, and it might be a marketing plan. But I would not like to be one of the 400 men that slept with her unprotected, kind of thinking,
I know.
Am I the dad? It's it's also really sad for the baby because you know that wee soul's got to live. Wondering who out of the 400 people could be the father, and I'm not sure if they took all the details of these people to, track them down and be like, do you mind doing a wee quick paternity test for us, please? Like, what was your name again? Can you imagine, when you check into a birthing appointment and they're like asking all the details, like, what's the father's name? We are trying to work it out. Is
and
there
just
one or
all
two,
the history, and is there any of this on the dad's side? And you're like,
don't even know his first name actually, but leave it with me. There is 400. We've narrowed it down to 400 candidates. Jeez. Also, why would you do something like that when you were ovulating?
True.
Wild. That was a bit of Russian roulette going on there.
No, she's obviously not perimenopausal.
No, she's not. Her skin looks great. She's using human sperm.
That's disgusting. We need to cut this bit out. This is so wrong.
We need to ask her what she's doing. That's her skincare routine.
Right, last bit on the notes was about breast reduction.
Oh yeah, because that was another thing that it's not about hair, but I find it quite fascinating. So, Brett, I would love this. I'm not going to be able to afford this when I move house, so it's off the question. But why is it considered cosmetic to get? So if you lose weight and your breasts are quite big, or not even if you've lose weight, because some people are just born with that body shape. Why is that a cosmetic procedure to have them reduced? Because to me, there's so many life implications on your neck, your shoulder, your sleep.
Is it though? Because I know people that have had it done. I don't know if they had it done on the NHS though, but they've had back problems and things because their chest has been so large and it's caused them actual physical problems. It's not due to vanity or anything.
But I think it's ridiculously hard to get on the NHS. No. Do you know?
So I don't know too much about this, but what I guess I could speak broadly. That I would say if you could prove that it was having significant effect on your quality of life, and that's quite vague, isn't it? So different practitioners will take from that differently. But I think if you were in chronic pain, if you were having a real significant impact on your quality of life, there would be an argument for it's a necessary procedure and you're not doing it at all for any cosmetic reasons. I think historically people have had breast augmentations and then changed, had issues with that particularly, or changed their view about their body and wanted to have reductions again. And so that kind of flooded the field, and people maybe thought, okay, originally breast reductions are only for cosmetic reasons, or that person just doesn't like the fact that they are a bit fuller busted, so let's deem that as more a cosmetic procedure, which would be harder to
it's
qualify.
A bit like saying you don't like the shape of your nose or something like that. At that point, it's not actually physically causing harm to you.
Yeah, but I think if you speak to your doctor, if you're having significant pain and it's really affecting kind of how you function on a day-to-day basis. They should be able to guide you to whether there's a pathway for referral. I mean, that might be, lots of referral pathways take forever, so it could be a long time. But or if there's a way you can get it done privately at a reduced cost. I don't know, but I think definitely you have that relationship with your own primary doctor, and you would speak to them about how to move forward.
It certainly is like a kind of strange thing, isn't it? Because like breasts are for breastfeeding. That's why women are born with larger breasts than men. And so it shouldn't be a cosmetic thing, but it has become that. And so I've got a client, and she had to go private because she was crippled, or she lost the weight, and she looks amazing. She's just done so great. She goes to the gym every week. She's totally obsessed. But she said like her bra was having to be so tight to hold them up so that she could actually just walk, and she was in agony constantly and sleeping. And I never really thought about that. Like if you're sleeping and your chest is particularly large, she said she had trouble breathing while she was sleeping because they were so heavy on top of her. And you think, well, that's actually a shame that the world has sort of started to perceive it as a cosmetic procedure and not an essential one. It's quite an interesting topic to get into, especially where a lot of the time if you're speaking to a male doctor who doesn't have breasts and therefore doesn't have any way in which to personally relate to that situation, it kind of feels like it's one of these other women's problems, isn't it? That's like, oh, you were telling me that really, the thing about the TENS machine.
Oh, yeah.
Like to finish us off, just talking about like men maybe not having experience of women's body, right? So go.
So women quite often find that if they're going into a GP practice or whatever clinical setting, that they're sort of, gaslight's probably the wrong word, but they feel like they're having to really sell their symptoms. They're having to say, I'm really struggling with this, and they feel a bit unheard. That's anecdotally, that's what lots of women will say. And so there was this viral video on TikTok that was talking about how like menstrual cramps are really, really painful. And lots of women experience this, but kind of it's sort of a bit like poo-pooed and sort of like everybody experiences this on a monthly basis to different degrees, like you're fine. And they were just out on the high street, like using a machine that's, I imagine it's similar to a TENS machine, but I don't know the actual machine. And it was stimulating pain. And they were putting it across their stomach and back, and to be like, right, this is what a cramp feels like. And all these men that they were interviewing were like tapping out at level 2, maybe level 1. And so then all these women were like, oh yeah, no, I get to like, they were kept going up and up, and they're like, no, it's probably a bit more intense than that. And they were getting up to
so
9 and 10. They were like, yeah, that's about right for me.
Oh my God.
And so obviously that's not all women, but it just showed you the extreme difference of like...
It's a really good way of showing men actually what we have to deal with.
And because we go through it every month, you just do become immune to it. Like you just part of life, isn't it? It's just like, oh God, I'm really tired or I'm whatever. And so it's interesting, especially from the self-employed perspective, because there's no sick pay for us. To like, if you're feeling absolutely miserable and totally rotten and crippled over, you just have to get on with it, you know, like, whereas certainly men maybe don't appreciate how hard that can be to get on with. God help them if they ever made a labour machine, you know, like, right, your 29 hours starts now. Oh, they would be like, what?
They say that though, there's a reason that women have to do it and not men. Men can handle it.
Yeah, no. Thank you so much for coming on. I really enjoyed speaking to you and getting some answers about it, certainly.
I think it's really relevant for now. There's so many people on these jabs and things. I think it's been really good to talk about it and kind of
normalise experiences for people, like, so that people don't panic and don't start thinking to themselves, oh my gosh, you know, especially with the perimenopause thing as well, like, because you've clarified that it's young. You can be young. You know, a lot of people probably think it is stress related and they're brushing off, and it could be something a wee bit more extreme. So certainly if think the final advice then, if anyone has any problems, to speak to their own doctor. If anyone has any questions they would like us to generally ask Lyndsey to clarify around a topic or anything, you're more than welcome to let us know. But thank you for watching, listening, liking and subscribing. We will see you next week with another episode.
Bye.
Bye.